All right, Pitocin and epidurals. So these are two of the main labor interventions, labor drugs that women are exposed to during a hospital birth. And there's quite a bit of misunderstanding, some misinformation about it, and sadly, sometimes it's the care provider that causes that. Not all the time, but sometimes the care provider is not giving all the necessary information about Pitocin and epidurals. So while, as we know, I'm not a doctor, but I'm a doula, childbirth prep educator, and I'm somebody that is a geek about reading peer-reviewed studies. So I'm going to share some information that you might or might not get from your care provider. I wouldn't recommend solely basing your decision on whether to accept Pitocin or epidurals based on this information, but I really hope it's a jumping off point for conversations between you and your care provider. So one reason that some care providers don't share, all the information I'm about to share is because a lot of the research behind it is emerging and evolving. So some care providers are like, I don't really want to share this information right now because I don't feel like there's enough evidence to fully back it up. I'm still trying to figure out if I believe that's an actual risk. So I understand that. But there's also some care providers that intentionally don't share a lot of the very known risk factors that I'm going to go over about these labor drugs, simply to promote their own agenda of having the mom accept the drugs that they want them to accept. For example, I was a doula for a mom who had a fall that wasn't that bad, but she went to her doctor just to make sure everything was good. She was about 2 weeks away from her due date. The ultrasound tech, she said the tech did a 2-minute ultrasound. It was super fast and was like, you have no amniotic fluid. And so everybody freaked out. The mom was sent to the hospital. The ultrasound tech at the hospital did an ultrasound and they're like, well, the fluid levels are a little bit low, but there's fluid in there and it's actually in the normal range. They're like, and the doctor, the on-call doctor was like, you're probably fine to go home. But the woman's doctor wanted to come in and talk to her. And he came in, he's like, nope, I'm going to go by the information that my ultrasound tech gave me. I think you need to be induced. What's happening is not okay. Even though it was everything he was saying was going contrary to everything that the hospital was saying. He's like, I want to start you on Pitocin right away. And the mom asked, well, what are the risks of Pitocin? He said, none. There's no risk. The only risk is you not letting me induce you. And then he told her, your baby could die if you don't induce, which was unequivocally not true. I saw one of the nurses when he told her this, and she was like, what? That's not true. There was nothing wrong with the mom and the baby. Nothing. So the mom turned down the Pitocin, but the doctor had scared her so much that she didn't go home. She stayed in the hospital. And so after 24 hours in the hospital with nothing happening, she allowed the doctor to give her 3 rounds of Cervidil, which is a medication that helps to soften the cervix. And typically you're on, the medication it's given, and then you wait 12 hours to see what happens. She had to go through 3 12-hour cycles of this. It didn't do anything. And then he just wore her down with saying, you need Pitocin, you need Pitocin. So finally, she's like, okay, fine, I'll take Pitocin. So she got Pitocin. It didn't do anything. After at least 12 hours on Pitocin, she had only dilated to 4 centimeters. And she was exhausted. She wasn't really in that much pain, but she was so tired. And so the doctor was like, well, get an epidural and so you can sleep. She's like, well, what are the risks of an epidural? None. There's no risks. Just get it so you can sleep. And at this point, she was just tired of arguing with them. So she's like, fine, give me the epidural. She got the epidural. It gave her a really intense headache. And so at this point, the doctor comes in and is like, oh, you have a headache? We're doing the C-section. And she's like, no, I'm sick of you and your interventions. Every time me and the baby are monitored, it shows that we're fine. there's nothing going on beyond me not having great reactions to these medications. So she fired him and hired a midwife that was on call in the hospital at that time. The midwife gave her a medication for the headache, allowed her to sleep. And eventually this mom ended up having a fairly positive vaginal birth, but God, she was just like exhausted and rightly so, doesn't have the best memories from her birth experience just because she was like force-fed these medications and was not given proper information about them. So this was the information that she should have been given about these labor drugs that would have excuse me, allowed her to make a more informed decision before consenting to either of them. Okay, so regarding both drugs, Pitocin and Epidural, this is a side effect for both of them. You will be stuck in bed. So once Pitocin or an epidural is started, you'll need to have constant monitoring and you'll be connected to an IV, so it'll make it really hard to move around. You're not allowed to eat because there's a concern about aspiration or vomiting during emergency C-section. They will not let you eat when you're on these medications. A lot of C-sections now, especially if you already have an epidural, they don't need you to be under general anesthesia. So there's some like questions around if it's actually needed for the mom to not be allowed to eat, but most hospitals are pretty firm with not wanting you to eat if you're on these labor drugs. And honestly, you probably won't be that hungry anyways, but not eating for long periods of time could lead to more exhaustion and make it harder to push the baby out eventually. Something else to know is that it might not work. Just like the story I just told, sometimes Pitocin doesn't do much, and I've seen that happen multiple times. A lot of times if you're already in labor and Pitocin is used to kind of like kick things up a notch, typically it does that and it makes the surges stronger. I've seen it be really effective when it's used towards the end of birth, when the mom's uterus is tired and it just gives the like little push to get the baby out. But I've seen it plenty of times where the mom was having no signs of labor, Pitocin was used and it didn't really work. Epidurals, on the other hand, almost always work, but there are rare occasions where it doesn't block the pain. Okay, there is an increased chance of cesarean birth with either labor drug because they lead to they can lead to what is called the cascade of intervention, meaning that you have one labor drug that leads to the need for another one and another one, and then eventually you get the ultimate intervention, which is a cesarean birth. I've seen Pitocin and epidural used plenty of times where the woman did not end up needing a cesarean, but it does increase the risk that you will need one. Okay, regarding Pitocin specifically. So sometimes Pitocin can cause contractions that are so unbearably strong you have to have, or you feel like you have to have the epidural. It's part of the cascade of intervention that I just mentioned. It's like you have no choice but to get the epidural because the contractions are just so unbearable. This can also lead to fetal distress because if those contractions are so close and so strong, or so close together and so strong that you don't really have time to relax and really breathe in between, and baby's not getting proper oxygen, that can lead to fetal distress, which could potentially lead to a cesarean birth. Okay, regarding an epidural, there's all sorts of fun stuff with an epidural. You will need a catheter because you will not be able to walk to the bathroom. You will have no way to like release the bladder because you can't feel anything. A catheter will need to be placed when you get an epidural. It could lead to the need for Pitocin because sometimes, not always, sometimes an epidural can slow or even stop the contractions. And so to keep labor going, they need to get you on Pitocin. Doesn't always happen. It could also extend labor. So there was a study done in the journal Obstetrics and Gynecology that found that epidurals typically cause a mom to have to push for 2.5 hours more than women without epidurals. Of course, this is not a foregone conclusion, but it's an interesting study to consider. An instrumental birth is more likely because an epidural makes it harder to really connect with your birthing muscles and push the baby out or breathe them down. Sometimes forceps or the vacuum is needed. You might have a drop in blood pressure. You get fluids before the epidural is placed, and these fluids really help to reduce the chance of your blood pressure dropping, but it can still occur, and that could also make the baby's heart rate drop. Fever could happen. A study done by Harvard Medical School found that if a woman, gets a pretty high fever after an epidural, it could lead to certain complications with the baby. Usually nothing that's life-threatening, but it can be not great. But again, plenty of people get the epidural without the fever, but it's a risk. Potential risk, you might get itchy. Sometimes the opioids in the epidural drip make you itchy. A lot of times they can either switch the medication they're giving you or give you a medication specifically for the itchiness. Nausea or vomiting is possible, again, because of those opioids in the epidural. Breastfeeding complications. So because an epidural blocks oxytocin, which helps milk come in, it facilitates bonding, because it can also make mom and baby a little bit drowsy. It can just make early breastfeeding a little bit more challenging, but not impossible. So a very rare phenomenon that can happen from an epidural is something called a spinal headache. So this is caused by an accidental puncture being made in the bag of fluid that surrounds the brain and the spinal cord when the epidural is placed. And this can lead to a really severe headache that could potentially go on for weeks, but again, very rare. Another rare potential side effect is nerve damage. So if a blood vessel is damaged while the epidural is being placed, the blood could collect and press on a nerve. This is actually one reason why women that have a blood clotting disorder or that are on blood thinning medications usually are not allowed to get an epidural. Okay, and the last very rare potential side effect is an epidural abscess. So this is an infection of the central nervous system caused by bacteria entering the epidural space. But according to Spinal Epidural Abscess, a medical journal, only 1.2 in 10,000 women experience this, so it's pretty rare. Okay, so those are the potential risk factors of Pitocin and epidurals that your care provider should let you know about, at least a lot of the initial ones. Sometimes they don't share the more rare risk factors, but they should really. They should let you know all that information. So following this is information from two studies that both acknowledge that research is ongoing. Their results are not conclusive or anything that should really inform a woman's decision about whether or not to accept labor drugs, but it's interesting research to kind of keep an eye on and maybe even ask your care provider about. It's has there been any more research about this? Do you know anything? But I would not necessarily base your decision on whether or not to accept labor drugs because of these studies. So without further ado, potential increased risk of baby developing autism. So as we know, there's all sorts of questions around autism. What causes it? Very limited research has found that babies of women who had Pitocin and an epidural during labor had a 2.77 times, or they were 2.77 times more likely to exhibit an autism phenotype than babies who had mothers that did not receive that medication. But because the children of all women who received both of these labor drugs did not develop autism spectrum disorder, it's believed that the drug must interact with other factors that cause autism. So again, much more research is needed. And there's also a potential link between Pitocin and bipolar disorder. So there was a study published in Journal of Affective Disorders that found that babies exposed to Pitocin during birth had a 2.4 times increased odds for developing bipolar disorder than babies not exposed to Pitocin. They also found a potential connection between Pitocin and cognitive impairment in childhood. So, all right. So again, while interesting to keep an eye on, don't base your decision on those last two studies. Okay, so now what do we do? How do we navigate, the care provider? Sorry, it's kind of hot in here. How do we navigate the care provider that is urging us to receive labor drugs? Or maybe they're just asking. Maybe they're saying, is Pitocin or an epidural something that you're interested in? How do you navigate that? So asking questions, asking lots of questions. So first off, ask, is this an emergency? So if the situation is actually an emergency, the care provider should be able to succinctly say exactly why it's an emergency and to say, this is what we need to do because of X, Y, and Z. And you'll probably be able to tell that it's pretty urgent. If it's not an actual emergency, then have them rewind a little bit with their suggestion and create more room for discussion. Okay, so if it's not an emergency, I would ask, is there an evidence-based medical reason you're recommending this intervention? If so, please explain to me. So some care providers recommend an intervention almost solely based on their personal experience instead of evidence-based medical research. So it's fine if they're upfront about it. If they're like, hey, look, in my experience with different patients, this is what happens when they get an epidural, or I've had all positive experiences with epidurals. It's fine. They're letting you know that their recommendation is based on their personal experience. But if they're making it sound like what they're saying is totally based on studies and science, say, okay, well, where from? Back it up. Give me some more information, please. The next one is two really important questions. Is this intervention really necessary, and are there any alternatives? So an article published in the Journal of Perinatal Education, they reported that when these two questions are asked, the rate of unnecessary intervention significantly goes down. The belief is that these questions, they really inspire meaningful discussion that can lead to more well-informed decisions. Okay, and finally, can you give me alone time with my birth companion to discuss? This is a rhetorical question. If it's not an emergency, you should absolutely be given alone time to discuss with your partner. I hope this is helpful. Oh man, this is a long video. If you have any questions about Pitocin or epidurals, let me know in the comments below.